Hello and welcome to YHTV's Magical Medical Tour. This is episode 36. Thank you for joining us here today. I'm Christina Suzama, and with me is our wonderful medical guide, Dr. Glenn Woolman. Hello, Glenn.
Hello, Christina. How are you?
Good, thank
Oh,
you.
good. I'm happy to hear that.
Have you adjusted to our wonderful time change?
I don't know. I don't think I ever adjust. I think I just have my own time, and it always stays that time. And I can't.
Please don't tell the children of the world that, okay?
Yeah. It was one of those very interesting things with the time change. It always was a big deal working in the emergency department because if you worked, say, that night shift, and let's say you started working at 7 at night and you work until 7 in the morning. If at 2 in the morning and when you had 5 hours to go and it moved backward, you had another hour of work to go.
Oh my gosh, I didn't think about that.
Yeah, it becomes, especially if it's a busy emergency department where a lot of things are coming in all night, and it's usually a late Saturday night, early Sunday morning time when the shift changes. Mm-hmm. But it works the other way for other people. When it's at 2 o'clock and you have 5 hours to go, suddenly, whoa, now I have 4 hours to go.
Right.
So people always had to work it out like that. So I think because of those kind of things, I tried to not deal with it too much. Right. But I think, you might be right. Maybe I'm not adjusted. That's what's going on. Now I get it. Anything new with you?
Yes. I love the early mornings that are bright. I like waking up at 5 o'clock in the morning and seeing the sun again. But it's really tough at the end of the day when it gets dark really early and we're used to working till 7, 8 o'clock and suddenly it's dark.
Boy, I know. That's one of my favorite parts of the year is that moment when you look up and you say, wow, it's 8 o'clock and the sun isn't even down yet.
Right.
Something like that. I love that time of the year. It's great. I don't know.
So who's our special guest today?
We have a very special guest today. By the way, greetings, everyone. And I'd like to welcome everyone to Magical Medical Tour. I'm Dr. Glenn Woolman. I'll be your guide along with Christina, our co-host, as we search each week through the healthcare galaxy for optimal health. Yeah, so most of the time on the show, I think we just keep expanding Magical Medical Tour and looking at all the quadrants. Everything's available to us. So we talk to a lot of healers and we talk to people that are being healed, like in our last show with Professor Lon Winston. And we've talked with administrators and scientists and a number of other people. And occasionally you and I have spoken, but we're usually speaking about a specific topic that for me is based in facts and reports and studies and things like that. Today we're going to go a little differently, but it's almost going to be, and I would like to suggest a contest for all of our global viewers. Maybe for the next 2 weeks, we'll start on election day here and we'll end it in 2 weeks. Contest. This is sort of something that I would talk about in a blog form rather than on our show, but I've decided might be fun to try it on the show. And I'd like to think of a word that we could use that would describe what it is when we're doing a show like this and it's blogging more than a lecture kind of thing. And I know there is a word called vlogging, but to me that sounds like flogging too much, and I don't like that. So I would like to find something or have someone come up with a suggestion for something that fits our show more. Both of our shows, maybe even, with Trinity, because sometimes we may want to do this. Anyway, a little contest, come up with a name for what we're doing on the days that we're just blogging visually and orally. And I guess we should have a prize. What do you think? Maybe a copy of Sleep Suite.
That sounds great.
Yep. I'm okay
to
with
put you to sleep.
That's okay.
After you spend so much time wondering, what name should I give it? What name should I give it? You're going to lose some sleep. So
I don't know. Well, I'll keep thinking. Maybe I'll win it.
there you
You know,
go.
I come up with a name, or maybe we'll open it up also to the production team, all of the sound crew, the lighting crew, the technical digital team that works with us all the time. Maybe we'll open up to all of those people. I don't know.
They would have fun.
Yes. They would probably come up with something. They probably came up with vlogging. I don't know. So today, I'm going to just blog a little. I'll call it blogging until I figure it out. And I working in the emergency department. When you're there and you're working a shift, each time you go to a patient's bed or to behind a curtain or into a room, you're seeing these running episodes of people's lives at times when crisis is usually at its peak. Crisis, anxiety, fear, not a lot of happiness most of the time. And there's this continuous running series of things that happen. I may see in one bed a 9-year-old girl who's taking her last breath because of a severe asthma and allergic reaction attack. In the next bed, I may see a 16-year-old boy who was in a gang fight and was shot in the chest and is potentially taking his last breath. There may be a maternal grandmother from a family of 4 generations that are all gathered around and she's dying. So things happen on all levels. And of course, there's happy things going on too. So every once in a while, we're delivering a baby there, or we fix somebody's something and they feel a lot better for it. But throughout that aspect, I was able to figure out, and along with, I must say, working with integrative medicine people at the integrative medicine hospital-based program that I was involved in, working with shamans and naturopathic healers and a number of different healers from around the planet. It seemed to me that there were about 6 aspects of things that people had to deal with. Of course, one of them is nutrition. There's no question about it. We need that for so many reasons. Another is exercise. It's really appearing to help the heart, the brain, the vascular system, musculoskeletal systems, etc. Stress and stress management, very important. Sleep and sleep management. We've had talks about that with Andy Binder and a number of others. Patterns of behavior and spirituality. These categories are the categories that need to be addressed by all people in order to have some chance of optimal health. And today I want to get into spirit. It's not a topic that I usually speak about because a lot of times, as I said, I would come in with most of my topics that would have a double-blind, placebo-controlled, meta-analysis, prospective crossover study. But it's not quite as easy to do that with spirituality. But it's a very important part because one of the things that I saw, and especially in those types of cases that I brought up before, where people were potentially in their last moments of life, depending on what they came in with and what we were capable of doing for them. The ones that had spirituality within their life and within their practice seemed to do better. They may have died, but they appeared to die better, and the people around them seemed to handle it better than the people that didn't. And I have a great story on this once. There was a man with having a severe heart attack, an elderly man. His wife came in. They'd been married for years. They were side by side. We saw that he was having a heart attack, and we saw that it was so massive that, and with all of the changes, he was not going to live for much longer. And we had choices of trying to give him lots of medicines, put him on a respirator, and maybe leave him in a coma for a long time. Mm. That kind of a choice. These are the many choices that are made every day in an emergency department. And we explained the situation to he and his wife, and they had choices. We could be aggressive, or we could be not aggressive and make him comfortable in his last moments, and left them alone for a little while. And because it was obvious that they had a spirituality between them, they came back in a few moments and decided that make him comfortable. Let's not save him. And he was totally alert. It was not like he was already out and not breathing. He was alert and total understanding of everything. The two of them had just a beautiful conversation. I wish I could have been more of an actual part of it, but I did get to speak with them a little more as we went on, and we chose to make him just comfortable. And it was beautiful. Tears, everything was very sad but joyful at the same time. So spirituality in health and in healing seems to be very important to me. And the problem is that, especially again in the emergency department, when people do not have that, they then try to get it while they're in the emergency department, lying on the gurney in the last few minutes. And some do, but many don't really. And so part of my process always is about preparatory medicine. So my suggestion in terms of spirituality is to try and get it before you need it.
Like everything else, right?
Yeah, like everything else. And so before I really get into it a little bit, I just want to give maybe some definitions. I think that would be helpful, at least my way of looking, because we always talk about body, mind, and spirit. So for me, a definition of body is everything from the skin and within and back to the skin. It's everything that we could take out, we could remove, we can look under a microscope, we could see in an imaging study, or we can analyze in some kind of a machine. That's the body for me. The mind is some element or product of us that allows us to make contact with the body, with ourselves, and with others. And the spirit is kind of a non-physical presence that allows us to see a bigger picture, to see our place in the universe and communicate with the universe as it flows around all of us. So those are my simple definitions of body, mind, and spirit. And today, what I would like to think about is how spirit is involved in three aspects of health and healing. And the first one I would talk about would be about the healer, doctors and others. And in this case, most often it's more the Western doctors. I kind of believe that a lot of the Eastern doctors, and we know many of them, and the shamans and all aspects, put spirit into their work. But the doctors don't always have that amount of time. So and it hasn't been a major part of our learning process in terms of learning about medicine and how to take care of people. One of the things that we learn is when we meet a patient, we learn how to take a history. And that history is very complex. And the more that we can learn from the history, the better chance we have of making a diagnosis and helping someone. That, of course, assumes that the person answering the questions will be telling us the truth. That doesn't always happen, and that's another part of learning to take a history, to recognize when maybe the person is either not telling the truth, or they may want to tell the truth, but they've never been able to, so it's a little struggle and it's time to help them bring it out. In the emergency department, a lot of people did tell the truth because it was about life and death situations. But taking a history included a present illness, included a social history. Do you drink? Do you smoke? Have you traveled around the world? It has a genetic history. Did your parents have illnesses, grandparents, any major diseases in your family history? Past illnesses, what kind of surgeries have you had? Medication history, what are you taking? What are you allergic to? There's a number of different parts of the history. But one thing we don't really ever talk about is taking at least a moment to find out someone's spiritual history. And I think that's an important part that needs to be added to the history taking among Western doctors, and maybe anybody that's practicing. If you're not asking that, it's a good idea, because especially now, people are traveling and we take care of people from all over the world, and each has maybe a different spiritual aspect to them.
I thought it had become quite common these days in the emergency ward to ask that.
We ask, the question is asked for a form, to fill out. But a lot of times that form has to do with other things being used. In other words, if something does happen, they may want to know to call a priest in, or a rabbi, or an imam, but it's not something that a lot of time is taken. Although that's what I'm saying. I found that when I did that in the emergency department, especially in those situations, it was very helpful in helping people to settle down, to ground themselves, to center, to get a little more balance. So I did that. But we may spend some time on it, but I don't think that we really incorporate it that often into how we're going to treat people. It seems like it's just another question that gives us information, but do we utilize it? And I'm thinking that more doctors should be utilizing it in their knowledge and the way they deal with their patients, and also in the way they prescribe things for their patients and how they go through procedures. And we'll talk about that a little later. I also think that doctors should become a little more spiritual within themselves as they see each patient. I know that if I was able to do it in the emergency department, as I said, I would go from one room to another. And before I would go into each room, I would try, if I could, to take all of my attention away from wherever else it was and bring all of my attention into this person who I was speaking to, because I was going to have to find out some very important things very quickly. Now, sometimes, granted, I might be worrying about the people in the 7 or 8 or 10 other beds, but I tried from a point of view to almost do my metaphor square breath before going into a patient's room. Of course, in the emergency department, I didn't have time to do the 4 square. I could only do maybe 1 square. But but because I practice it a lot, just going in the 1 circle takes me to that place, and it brings me to a place of attention and intention as I go in to talk to and examine people. And also the part is when we put our hands on people. That was an important part for me too. I tried to make a connection. The first thing that people expect of a doctor is sort of, after a hello and a greeting, it seems like a natural thing that a doctor might put their hand on your wrist and take your pulse. And I used to do that immediately after introducing myself, because I wanted to make touch and contact. And that contact was very important because, in a way, depending on the person, it exuded my confidence and my professionalism. But it also, if I had an attention and intention of doing my best for that person, sometimes that came through me, through my fingers and my pulse, into them. I believe that. And it allowed me, and I kept my hand on their pulse even long after I was taking the pulse and counting it and looking at all the important parts of it. I would still keep my hand on them to make that contact because I thought it was very important. And sometimes it did give me clues to things. So that's another aspect that I like to speak about in terms of the healer's process. You and I both know and go to an esoteric acupuncturist, and he takes it to a very spiritual level when he uses his needles on people. I've had many discussions with him, and as I'm sure you have, he believes that anything that he puts into his body comes out through his needles. So he tries to be as pure as possible as he manifests and works with people using his needles. And I think that's an area. Certainly, I don't know that Western doctors could do that on the same level at all times, but I think it's an interesting way to see it. And I think more of us that would look that way, it would be better for the entire practice of medicine. It would bring us to a more holistic place.
Mm-hmm, mm-hmm, mm-hmm. I completely agree. I mean, I can definitely tell the difference when an individual, even if it's like just the dentist,
Mm-hmm.
if they are healthy or not, I mean, I feel it. I feel it because they're breaking the space with me when I call, a person's space. And it really, you can feel, either if someone's healthy or if they're not. And I am a little more sensitive, but I have other people making the same comment. So, there are, like I say, there are even masseuses. When people go in to have a massage done, I say, it's really important who's doing that massage and how clean that individual is and how balanced they are. Because, they could also be spreading someone else's energy.
That's right.
To you.
That's right. And especially if you work with a lot of energy people, could you imagine all of the different energetics that are happening in an emergency department
yes.
at any given time, especially in a downtown county facility during, certain times of the year, et cetera. There's a lot of energies going on. And it's been interesting to see people that were energy type workers dealing with that in the emergency department. Mm-hmm. In fact, many times that was some of the reason for the angst of some of the people that I had to work with and calm them down. It was almost easier to calm them down from what they had than from what they were taking in from all the energies and spiritualities of other people. Mm-hmm. And that's why I say one of the important things, I think, for each doctor, what I do now, I know with my clients as a medical guide, I try to allow a certain amount of time between clients so that I can sort of take in all of what my client had and debrief myself from it for the moment, and then bring in the process of the next client coming in and be fully prepared and fully mindful of what they're coming in for, and to have my attention to them. The second category, unless you have some more thoughts on healers and spirituality.
Oh, no, the one area I would say would be how one can transition, such as yourself. You're going from room to room to room, dealing with these people. And I mean, how do you keep yourself clean from something like that? How do you, away from your metaphor square breath, to refocus and sort of like to make that shift from one patient to another? And most people, as you say, are critical in that kind of situation.
Well, another way to do it, another little handy thing, which I'm going to bring up in the third aspect, is...
So we'll wait for the third aspect.
Yeah, okay. No, we could do this. Is taking a moment to wash your hands before each different patient. And so in a way, it becomes a little bit symbolic. where for that moment, I'm washing my hands of this person. I've done everything I can in that moment. I'm washing my hands and I'm coming in clean again. And sometimes, depending on what we're doing, putting on a different gown or, mask or things like that. And there are many different ways that people have their own method of transitioning. Sometimes you put down the chart of one patient and you pick up the chart of another patient. So as you're putting down that chart, symbolically, all of their information, you've done everything you can, you've written your orders, and now time has to happen so that orders can be followed out and you can see treatment results of something. Somebody's having an asthma attack and I write an order to a nurse to give a certain medication or do a certain type of treatment. I put that down and then I pick up the next chart and I start looking at it, reviewing it, thinking through it. And in that whole process, it brings me into a spiritual sense of what this person is going to need from me now and how I can be more open to what they need at the same time. So in the second category, we've just dealt with healers. Now, patients, people. I think from the point of view of dealing with the doctor first, I think it's very important to, when you meet with a doctor, after you go through the general history, if finding out all of the important things about you clinically, if the doctor has brought up your spirituality, then you've already answered the question. But if they haven't brought it up, it might be something worth thinking about, just to let the doctor know what your spirituality is. It may or may not make a difference to them, but maybe over time, if more doctors hear that patients want to know and want the doctor to know just as much as my blood type is A positive, this is my spirituality as you go around trying to work with me and give me things or treat me in certain ways, operate on things. So I think that from a patient point of view, I think it's a good idea that people bring into the doctor's database some of that information. It may help them at some point, may help the doctor at some point if things become critical. It may give them some ideas on things to do, maybe in final days or choosing hospice or different types of medications that they can offer or counseling, number of different things. So I think it's a good idea to share it more on a medical healing level also. That's something that I think needs to be done. And sometimes if the doctors start doing it, that's good. But if they don't, I think it's a good idea to have the opportunity to bring that up. And then, of course, for patients to develop their own spirituality and learn to work with it in healing aspects also. And certainly many people that do this, pray for health and wish for abundance and prosperity. All these things are always in different parts of spirituality. But, or at least I guess in some spiritualities, I can't say for all, but it should be a daily practice of health to bring spirituality into the life of your health and healing. And there are many ways to do this, and the ways that you do it, if you have aspects, and this comes in with connections of body, mind, and spirit, in times when health usually affects the body first, then the mind picks up on it and starts doing things with it, and then a connection needs to be made to spirit to find out on both parts. One, many of these people that we speak with talk about root cause analysis, and some of the more natural type of healers are looking for things other than a certain type of a bacteria or a fungus or a parasite. They're looking for a deeper cause of things. And when you're trying to heal someone, you need to look on the body level, the cells and everything. You need to look on the mental aspect, but you also need to connect it to the spiritual aspect. And when the three are in line, people are in balance, and that's harmony. And most of the time, people are healthy. It's when there are imbalances somewhere that imbalances eventually manifest as a disease or an illness or something like that. So in your own work, in each person's own work, by having a spiritual practice, sometimes you can pick up more quickly and easily than someone outside of you, meaning some kind of a healer, especially a Western healer. You could pick up your own process if you do enough work to possibly guide the healers into what's wrong. And in some cases, you can figure out what's wrong on your own even more easily and look for your own solutions, which are always good. So that's another aspect that I believe. And I think the more work that people do included into the health aspect, the better off they appear to be when serious health issues do occur.
But Glenn, don't you feel that that word spirituality, there's so much confusion between that and religion?
Yes, I think so. That's why I specifically used the word spirituality rather than religion. I think one of the things that I like about spirituality is that it can be done between a person and their own spirits. Religions sometimes have people that intercede, and sometimes for the best and sometimes not for the best. But I believe spirit, again, is just something that's not a part of us that connects us to the bigger picture, that puts us in the universe and helps us to be centered, grounded within it. And in my practice, I practice it the same way that I practice the rest of my medical guiding. I have an understanding of many of the spiritualities that are out there, and I look for the person's spirituality and helping them to guide them to their optimal health. I don't try and put another spirituality. And sometimes, in my experience, most of the world's religions at the very core say almost the same thing. It's about love. It's about caring for others and doing to others, those kind of things. And I think they're all similar like that. It's just the way that they're practiced sometimes that are different, and in the name of different spiritualities. So I look for, if a person has a certain spirituality, that's what I look for. And sometimes I will include aspects of other spiritualities to help blend them. To me, even spirit sometimes can be combinatorial medicine. I practice combinatorial medicine just like I can have Western and Eastern medicine. There's no reason that you can't have combinatorial spirituality. Now, some people argue that, and I don't want to get into the argument of spirituality right now, where if you're not pure in one, then you're not pure at all. And that, to me, I accept that as a spirituality, and that is what I would work with whoever had that. But yes, I agree. Spirit and religion, both are good. Both can be similar, but we can find some differences in them. And I think that's more in Trinity of Life than Magical Medical Tour, but maybe not. What do you think?
Combinatorial medicine.
Combinatorial spirituality.
Yeah, body, mind, spirit. It all comes together.
They need to be connected. There's no question that they need to be connected. So I'd like to talk a little more about the third area, unless you want to talk a little about the second area. So we've talked about healers and spirituality and patients, or people with spirituality. Anything that you want to go before we go to our third aspect?
Something very interesting that I'd learned recently, because there's always, when we do speak on Trinity of Life, etc., and I do speak to people about spirituality, there is a hesitation and fear because, they see it almost like an organized religion. So do I. So that's kind of what keeps coming up with a lot of people anytime we mention spirituality. It's like, oh, that's religion and this and that. And it's like, no, it really isn't. And recently we had a visit from the Himalayan masters, Yogmata Keiko Aikawa from Japan, and Pilot Baba, who is from the Himalayan mountains. And it was very interesting because I had imposed that question on Pilot Baba. And he says he replied with, because they have their chanting. Yes. And he says, no, it's not about religion. He says, it is about, it's all based on science. What their meditations and what they're saying, like their mantras, is all based on science and how to rebalance the body, and the mantras that are being said, how it resonates on the cellular level and the core level of the body, and that's hence why different people have different mantras. Whereas here in the Western world, we all pick up a mantra and it's like, oh, we'd like it because we'd like better health. So we're all saying the same mantra, so to say. And in their world of spirituality and balance, it's every individual has their own private mantra. And the tones of that mantra resonate with the body at a different level to help rebalance those areas in the body. So that was really interesting. That was a whole nother take that, that he shared with us on that.
Well, yeah, I agree. That comes out for me in the study of the Hindus, and the languages, Sanskrit, and before Sanskrit, the Pali languages. When you speak with people that study Pali and Sanskrit, all of the words and symbols had those vibrations. We think of words here in America, or the United States or in the Western world, just as it's a sound, but it's mainly a definition or a meaning, is how we use words on a daily basis. But in Pali and Sanskrit, those words did have vibrations to them, and sometimes multiple vibrations to them, and they were used for specific healings like that. I agree. And I think it is fascinating that ultimately it would be really nice, of course, from a scientist point of view, to know that spirituality was also scientific, because it means that we could know more and get better.
Yeah. Yes.
I like that.
Yeah. Make these sounds, cure yourself.
Yeah. Well, there's a lot of people that do sound therapy, the chakra bowls, the singing bowls. And when we talk about chanting and mantras, even the process itself of chanting or saying mantras, one of the things that we've learned using the electroencephalogram, putting all of the wires on people's heads and measuring the scalp electricity and wave patterns through the skin and the scalp of people that are in different states of awake and meditation and sleep, we see that meditators seem to go into deeper meditations when they're exhaling rather than inhaling. And so one of the things that happens when somebody is chanting or saying a mantra is technically you're exhaling. Nice. And in doing that, it does bring you into softer states, meditative states. So it calms you down. It lowers stress. It helps healing there. It calms the cells down. Vibrations change. And we go on from there.
Mm.
So let me cover the last aspect of spirituality. And that to me is about treatments. And I like this one the most because in spirituality, there's a lot of ritualism. And that continues the spirituality practices, different ways that people pray, different acts that people do at different points in their life based on religion and spirituality. We go through lots of rituals. And medicine is no different. We look back to the very beginnings of medicine, maybe in caves and then with the Greeks and, in the sanctuaries, with Asclepius and with Hippocrates, and there's lots of ritual. And when I was doing my surgery residency, that was one of the most ritualistic processes I've ever been in. In a way, you can metaphorically say that we would go down into a cave, and that cave would be, of course, the surgical suites, but it's away from other parts of the hospital. Usually, they were either down in basements or they were up at the roof or something, but a lot of times down in basements. So we would go into these caves, and then we would start these washing processes where we would scrub ourselves as the physicians, the surgeons we were going in to operate. We would do these cleansing ceremonies very carefully. And then we would walk into this room where the patient was up on a slab, probably historically on a piece of rock somewhere or some kind of a table. But now in modern times, they're in a surgical suite on a surgical operating table, but it's still, this patient is there. And immediately when you walk in the room, attendants come to you and put you in these gowns and garb you, and you put masks on and hats on and disguises. And then this team comes around and you're anointed, probably with oils of certain kinds in historical times. But now we're using a cleanser or an antiseptic or an antibiotic type of solution to clean things off. Then we put robes over patients, and then we enter into their bodies and remove things from them and try and put them back together. It was so ritualistic for me that it's very important, I believe, to continue the ritualistic process within all of the things that we do within medicine, but to bring it into a spirituality. Certainly you could imagine that in early times that spirits were invoked as you were trying to heal someone in some medical form. And we seem to lose that a little bit now. Not always. People do bring it in certain places, but I think that everyone should bring spirituality into their own healing process. An example for me, and these are things that I learned in working not with Western doctors, but with homeopathic doctors and naturopathic doctors and Asian medicine doctors and Ayurvedic doctors and shamans, that they, for example, they did some kind of a process with the medications or herbs that people would take. And you had to honor it in some way. And I try and take that process now with my clients, where before they take a pill, even if it's a Western antibiotic pill, that before they take it, they should go through a little ritualistic process of first coming into alignment with spirit, mind, and body, and to allow something to enter your body with the understanding that there's something that's wrong in your body that needs a healing, and you want your, we call it the temple, we call it the sanctuary, whatever. We each have our own name, but we need to honor this thing, this embodiment that we're in. And when something is wrong with it, our natural defenses are to keep things out of it. So when we're trying to take a medication or to have a procedure done, I think it's a good idea to have a ritualistic process to first, let's say, taking just an antibiotic. First, just take a moment before you just take the antibiotic and allow for your body to think about itself and to open itself up to allowing something foreign to come into it to do a work that it has to do to repair something and heal you. And then the second part of that for me is to actually honor the drug or herb or liquid or medication or whatever and allow it to have the right energies to come in and properties to come in to do what it's supposed to do. I think it's a nice little ritualistic process that when I do that with my clients, they seem to get more out of it. They seem to realize that taking the medicine is an important part and that they don't forget it as often. So that's an important part of just taking medications for me. And then I could talk about some other treatments, but do you have any thoughts on that?
Oh, absolutely. I love that thought, that process. So no matter if it's in a pill form or an herb form or an homeopathic form, you help them to create this little ritual around the medications. Is that correct?
That's correct. And it's a two-part ritual. First part is for yourself, and then it's for the whatever you're taking in.
I love that.
Yeah, to honor both of them. I mean, I've seen different aspects of that in different healings. You know, in homeopathy, with their remedies, they tap or shake the bottle of the remedy itself before you take it in, and there's things that you do with it. And shamans do a lot of different things with their herbs and medications. So I think that the body needs to be part of it and allow something to come in to naturally loosen up the defenses that we try to have about something foreign coming into us. We need to take that one moment to open up and to allow something to come in with a purpose behind it. And if the purpose has a spirituality along with it being connected to the mind and connected to the body, then it tunes in a little bit better. And sometimes it would be interesting to do a study on this. We've done some studies, but on terms of blood loss and pain medication after surgeries and getting out of surgery more easily with prayer and spirituality. In fact, we did a study where we presented something. I think Jan Ingram in one of her interviews as a nurse went to the Mayo Clinic to present a program that we did at our hospital. But I think that it brings it in very nicely. And the next thing I'll talk about maybe is, for example, surgical treatments. But yes, I think it's a good idea.
I love that flow of the ritual, or just in some cases in some worlds it's like raising the frequency of what it is you're intaking. And it's like with food, and when people say their blessings or to food before they intake it, or in some religions it's what do they call that, Glenn? To say grace with their food, right? They're raising like the frequency. Why not do that with anything we intake? And especially the medications that are brought in to heal our bodies and create balance.
Yes. I think it should be expanded out into everything. And it's a way, it's a form of what people like Jon Kabat-Zinn and a number of others call mindfulness. And then you talk about, yes, we should have mindful eating and mindful conversations and mindful thinking and mindful sports, mindful everything. But since this is Magical Medical Tour and we're talking about health today, I don't want to have to bring it to everything right away, but we could at least bring it into healthy aspects.
Absolutely.
Yes, I agree with you. I would encourage people to bring that into when you eat and everything else that you do. Yeah. In terms of something like a treatment, surgery, for example, surgery for most people is devastatingly fearful.
Mm-hmm.
Most people are not happy about it on many conscious and subconscious levels. If you have to be put to sleep, just the act of being put to sleep where you lose your own control, and you don't know if you're going to wake up, and it's not about you, you're out of control, you're naked to the world, that could be very scary to people on subconscious levels. So preparing for surgery is something that I also do as a medical guide, and there are many parts to it. I don't want to get into all of it now because each person is unique, and again, you have to, if you take a history with someone and you ask them about their spirituality and you're trying to prepare them for surgery, it's best to speak in their terms. So it's very important that way. But I like to work with people that I know are going to have a procedure, and I set up a mantra for them, actually, and it becomes it's sort of a visualization, meditation mantra. And the mantra, they should do it every day before the surgery, and they should also do it. I instruct them to do it whenever a fearful moment comes into their consciousness about the surgery. But before I recommend they do it when the fearful moment comes in, I recommend that they use that moment and analyze it. Why did it come in? Why did it come in just at this moment? What is the fear? Learn about that and see if from a scientific point of view, you can figure out why it keeps popping up and what I'm so afraid of. Where does that come from? And look for a healing from that. So that's the first thing I say when a fear comes up, especially based around a surgery. But then the second thing, after you've done a little bit of analysis, you can also continue to analyze it and say, how much did I obsess in that fear before I recognized that I was thinking about it even? That's an important part also. You say, wow, I just spent the last 8 minutes, or was it, I caught it in 3 seconds. So it's very important to try and recognize that as part of your analysis too, as to where your mind works and the mindfulness of your own consciousness through every waking moment. But as soon as you've figured all of that out and the rest of the answers to life,
the surgery will be over.
The surgery, yeah, you may not even need it. You may have healed it. But then I have people go through this ritual. And I've done this myself with myself. And of course, my visualization is a lot deeper than what I do with many people because I have so many aspects of knowledge of anatomy and surgery and intravenous lines and everything. But I start a process with them where I have them starting to picture. First, they look at themselves and they say something, and we work this out. I'm just giving you a little bit of an idea what it is now. But we say that at this moment in time, if you've done all your good work and you've practiced preparatory medicine with your medical guide and you were in the best health you can be in, then at this moment when you're having this surgery, you're in the best health that you possibly will ever be in without it. So you honor that. And so you honor the fact that you've made the choice to have the surgery, and you go ahead with that and saying, this is the right time and this is what I want to do, and I am ready for it. And then you start looking at yourself. And again, you have to now allow your body to open itself up to other people that are going to not only just maybe give you a medication, but now you have someone who's going to be standing over you with a very sharp instrument that's going to just open you up somewhere, and reach in and start doing things inside of you where no one else gets to go. Mm-hmm. So you have to open yourself up to that and allow someone else to enter spiritually, mentally, and physically. Mm. And when you make that connection, it makes it better, because if we see many times people that go under anesthesia, sometimes under the normal drugs, they're not getting deep enough. And we can tell that because a surgeon who's getting ready to go into someone's abdomen can feel if the abdominal muscles are still tight or when they relax, when the anesthesia takes over. They can tell that. And sometimes people are so unrelaxed for various reasons that the anesthesia takes a little longer, or they have to go to stronger doses. And some of that may be, and this would be another study, to see if the spiritual subconscious part is preventing that. So you have to let people in, and then you start imagining the doctor that's going to be working, and you say they're at the top of their game, and the anesthesiologist, top of their game, all of the attendants and nursing staff, top of their game. It's going to be the best surgery ever. All of the medication's going to work. And the second that they start working, I'm already looking toward healing. And the moment they close me up, I'm already in the process of healing. And that mantra, some variation of that is a thing that I have them work in. And the last thing that I do as a great ritual, and everyone that I've done this with has just been so happy about it. And I think I may have mentioned this before somewhere, maybe in one of the Yoga Hub conferences, where just before you go out under anesthesia, and you could do this if you're not going under anesthesia, you could do this for any procedure, if it's even something where it's just local and something else. But basically, before you go out under anesthesia, the last thing you do is smile. And when you smile, it starts out with a face smile. But then you, through your concentration, make that smile expand down to your heart, and then expand where your whole body goes into a smile. And that's the way you enter surgery, where your whole body is in a smile. And then I say to them, the very moment your consciousness returns, either in the surgical suite where you're still on the table, or back in recovery, or somewhere else, that very moment that you come back into consciousness, you repeat that smile. And you start with the smile of your face. Of course, you're going to be a little groggier this time and not totally into it for a moment, but you concentrate on that smile. That's how you're going to arise back into consciousness from the surgery. That starts in your mouth, goes around your head and face, goes down to your heart, and expands out. And even if that only lasts for a second because you go back to sleep due to the anesthesia, you've now surrounded your surgery in a ritualistic, spiritual smile. And it just does so much for people. So I think that, from those aspects in spirituality that we've spoken about today, it needs to be brought into healing from every point of view. Doctors need to bring a little more spirituality into their practice. Patients need to bring it to the doctor's practice and into their own practice. And in doing any kind of a treatment, a medication, even if you're putting on an antibiotic ointment for some reason, you have a little cut, take a moment and just look at the cut, clean it up, honor the fact that you have a body that protected it and didn't make it worse. And then take this ointment, simple, antibiotic ointment, honor it for a moment and allow it to do what it's going to do without hurting, without side effects. Only it's going to have its pure, perfect purpose. And I didn't mean to say pure, perfect purpose.
Triple P action.
I don't think I could say it again.
Oh, I think those are some really, really wonderful tips, Glenn. And I truly believe in that whole process of mantra as we're leading up to something. I did use it when I was about to give birth, for months before. And it really, really, I feel, made such a difference, to the labor and the birthing section of having a baby at an older age, etc., that everything was so calm, no matter how many hours ticked by. Everything stayed, at a really lovely calm. And I do believe that when we continue to honor ourselves like that and allow for things to unfold. It works on many, many levels. So it's lovely to hear you say that and share those wonderful techniques with all of us. And I will definitely practice each and every one of them.
Yeah. And, we spend so much money and energy trying to get things that will help us, buying supplements and getting organic food and doing all of these other things. This is something that costs nothing but has a great benefit.
Mm-hmm. I believe so. It is truly back to that Japanese doctor, and I always forget his name, when he was doing all the scientific research with water.
Miyamoto, I think.
Miyamoto, I think, yes.
I don't want to be quoted on that.
Yeah, me neither. And how, as you know, that the wonderful thought processes and how it changed the formations of water. And that's what we're really made out of, aren't we? Where so much of our body is made of water in our cells. So, yeah, that's wonderful how you're showing and guiding everyone to shift within our bodies, shift within our cellular levels to create balance.
Yeah, connecting the body and the mind and the spirit, all good things. It seems to be buzzwords, but since they've been buzzwords for thousands and thousands of years, there must be something in it. I want to remind everyone about our contest, which is to figure out a word for this kind of a show, giving away Sleep Suite for the next 2 weeks. And you can watch it live. People that are watching live, I guess, can have the advantage of getting in the contest early. Otherwise, go to maybe iTunes and they'd be able to watch it on a podcast, either going to Magical Medical Tour or Yoga Hub or YHTV. And if, by the way, you're looking for this or other shows, you can like them and vote on them. Give us a good rating. We like that.
I completely agree. Yes, and of course, on the show, on the website itself, there will be links to the iTunes podcasts as well. So really help everyone out to get there, as we have other links about the show and refers to Dr. Glenn Woolman. So we thank everyone for joining us here today, especially our very special guest, our Dr. Glenn Woolman, our wonderful medical guide.
Thank you, Christina. I would like to say that I would always, of course, like to thank our viewers. I'd like to thank my healers and my teachers for helping me on my journey. And until we meet next week in another aspect of the healthcare galaxy, I would like to wish all of you optimal health.
Thank you, Doc. And of course, as he says, thank you to all of you for joining us here. And we invite you to join us live every Tuesday at 11:30 a.m. Pacific Standard Time, 1:30 Eastern Time for our Magical Medical Tour. Wednesdays for our Trinity of Life at 11 a.m. Pacific Standard Time, 2 p.m. Eastern Time, followed every week with our new show, Flowing into Awareness with Anatara. And you can also find Dr. Glenn Woolman at myyogahub.com/G Woolman, and on Twitter at Glenn Woolman, and of course through his own site, glennwoolman.com, where you can learn about his Metaphor Square Breath and contact him.
I'd like to leave everyone with a health tip.
Oh, must have that. I thought the whole show was a health tip.
This is a very special health tip.
Please share with us.
Go out and vote.
Go out and vote.
Thank you, everyone. Thank you, Christina.
Thank you, Doc. We shall see you next week. Namaste.